All right, everyone. Welcome to the Regenexx webinar. I'm Dr. Jesse Sally. Thanks for joining us today. I'm talking to you from Regenexx Pittsburgh, your main orthopedic non-operative regenerative medicine and sports medicine specialist. Today, I'm going to be talking to you about our Regenexx procedures, and I'm going to sort of give you a rundown on some of the different types of procedures that we do, how these treatments are performed and why that's important, and also what you can expect from the procedures and why we differ from a lot of the alternatives that are being presented in the community. So who am I? Like I said, I'm Dr. Jesse Sally. I am a graduate of the University of Pittsburgh Medical Center fellowship program in musculoskeletal sports and spine. I did my training at Virginia Tech, both for undergraduate and medical school. I'm an osteopathic medical specialist by training. I'm an avid snowboarder and cyclist. This is the group of us, Regenexx Pittsburgh, myself and my partners, Dr. Adelsheimer and Dr. Lieber. Our main office is in the Pittsburgh area in Fox Chapel. We also have a few satellite offices where we also see patients and perform follow-ups. One thing to take away from this is that our office is a max COVID-19 protection zone. I believe now the majority of our office, I think everyone is vaccinated completely. We've been wearing masks, following all CDC guidelines, checking temperatures, and making sure that everybody is safe across the board when presenting for procedures or evaluation. So you're here today to talk about some different options of how to reduce pain, avoid surgery, different options for care. And there's things that you consider in your medical care when you're sort of looking at different options. You know, you want to avoid a lot of downtime. You may not be a good surgical candidate depending on age or health risks, or you don't want to rely on medications. And some doctors may have told you that you just need to learn to live with it, but you're not ready to slow down. And you basically want more from your life. So what can we do? So today we're going to talk a little bit about what Regenexx is. We're going to talk about current options in the Regenexx family of procedures, why we've kind of dubbed this interventional orthopedics and how that differs from other options around the area, who is it for, and what kind of results you can expect. So really the future of this medical intervention is biologic. We're shifting the repair from management with medications or injections or other things to basically helping the body to repair itself using these orthobiologic procedures. So if we look at the natural healing process, and you can consider this like, say you get a cut on your arm. So you have the initial injury, you're gonna have some bleeding, it's gonna form a clot. Underneath the clot, inflammatory factors are released. That's what causes it to hurt. That's what causes it to get red, itchy, painful. But that process actually is what sparks the stem cells and the platelets to come in and start the true tissue regeneration pattern. That leads to tissue remodeling, and then eventually you can flick that clot off after a few days and you get complete healing of the tissue underneath it. So really, when we're looking at cartilage metabolism with how your body maintains cartilage or maintains these balances, what we're trying to accomplish is we're trying to get a greater buildup process than we are a breakdown process. And as we age, the breakdown process is what tends to outweigh the buildup. And that's from buildup of inflammatory factors. It could be injury, it could be surgery, it could be all sorts of different things that trigger that, that catabolic breakdown. But we want to try to swing that scale so that the buildup becomes the heavier of the two. So there's different types of regenerative treatments we can talk about. We're going to talk about stem cells. We're going to talk about platelet-rich plasma. We're going to talk about platelet lysate, which is just a different form of platelet-rich plasma. And we're also going to talk about prolotherapy. So when we're talking about platelets, platelets are the natural healing element in the blood. They're basically, they contain all the growth factors and healing factors that are found in the healing process itself. We use the platelets in two ways. One is that we use the platelet-rich plasma, which is the SCP, and the platelet lysate. So PRP is basically used for joints, it's used for tendons, it's used for ligaments. we can concentrate those platelets to different amounts, and the growth factors are released slowly by the platelet. Platelet lysate is what we can use in spinal procedures or around nerves, because we basically remove the shell from the platelet, and we use all of the good growth factors inside the platelet. So the growth factors are released very quickly and very immediately available, so that they can start that healing process very quickly. It's also safe to inject around nerves, into the epidural space, into areas that otherwise we could not use platelets. So at Regenexx, we're talking about adult, not embryonic stem cells. Everything that we do as a procedure is considered autologous, meaning that it comes from you and goes back to you. The focus of some of the stem cell treatments is going to be around mesenchymal stem cells. And these can come from a couple different places, and we'll tell you why each one's a little bit different. We use the bone marrow derived stem cells, which come from your own body, like I said, but there's differences with adipose derived stem cells, which can also come from the body. But our processes have a little bit of both, but I'll tell you why some of the adipose treatments are a little bit different. So what is an adult stem cell? A stem cell is basically just an undifferentiated cell. It sits in the body and waits for it to be given a job. So it's held in reserve until a repair process is needed. When a repair process is needed, the stem cells get called in from the bone marrow, like I said, from those platelet responses or from that injury inflammatory response. They can turn into many different types of cells. They have different types of jobs, but those stem cell changes occur when they're stimulated. And so they can orchestrate repair responses, particularly in areas of cartilage damage, muscle damage, any sort of repair that's needed in the body. And they also self-renew. So in the body itself, when they're held in reserve, when you take stem cells out, your body also rebuilds more stem cells to start that process again. But even in the course of the treatment, they self-renew in terms of growing and dividing as they're creating that ongoing healing response and that ongoing repair over time. They also help with providing new blood supply, which is good because you need blood supply in these areas of long-term damage to be able to bring good stuff into the area for healing and to also take away the bad stuff that's creating inflammation and degeneration. So stem cells are new biologic tools that are available to treat musculoskeletal injury and degeneration. They provide new growth, new tissue of growth, or new tissue growth within ligaments, tendons, bone, cartilage, basically all of the areas that are consistent with musculoskeletal pain. Like I said, they help to repair and speed the process of healing damaged tissue. And they are specialized cellular processes. And our processes actually help to yield more concentrated and powerful samples than a lot of the other cell types. And we'll talk about that too. So Regenexx itself is actually an orthopedic surgery alternative. We've actually dubbed this a new medical specialty called interventional orthopedics, meaning that we treat the same issues as orthopedic surgeons do. We're just using more interventional approaches, needle-based, finely guided procedures in order to heal those tissues rather than doing incisions and removing or doing repairs otherwise. Orthobiologics are the products that we use. Orthobiologics basically meaning biological products that are used for orthopedic healing, so stem cells and platelets. Like I said, this is advanced regenerative medicine. This is a highly specialized medical science. It's a trusted alternative to orthopedic surgery as well. So the Regenexx difference in terms of stem cell processing is that the quality and the potency of the products that we use is much greater than a lot of other products that are found on the market. You're getting an introduction also into a positive milieu, meaning that we actually prepare the joint in a little bit of different way to help those stem cells activate once they're introduced. If you just introduce a stem cell into an area where there's not a good environment, it won't do the job that you want it to do. And we're looking to very specifically target the areas that we put these cells with image guidance, whether it be ultrasound or X-ray guidance. We also use stimulants and adjuvants for growth of the stem cells. Mainly that's usually platelets or PRP, and those cause continued stimulation. And we use a customized product to help with injury in individual patients. And we also avoid any medications or other things that may antagonize that stem cell growth. And we follow every patient's outcome as we go along afterwards. So the Regenexx differences, again, most of the time we're using platelet-rich plasma for these procedures. We do about 20% stem cell work in terms of our procedures, and they're used for very different purposes. There is a significant cost difference. Not everyone needs stem cells, and we kind of take everybody's cases on a case-by-case basis, and we try to delineate what is going to be the best treatment for you, depending on the symptoms and depending on what we see. The conditions treated: arthritis, tendonitis, torn ligaments, meniscus tears, spine pain, disc issues, and nerve damage. Basically, all of the different conditions that you would see treated in any neighborhood orthopedic office, including spine issues. Basically, I tell everyone that we treat everything really from the neck down. It even applies to hands, fingers, toes, everywhere that it can be having issues. So commonly treated areas that we address, again, the same as would be for any sort of normal orthopedic office: shoulders, elbows, wrist, hand, hip, pelvis, knees, ankle, foot, and spine. So really, when you're looking at current options in orthopedic care, you go to your orthopedic office or you go and see your PCP, what's the first thing that they're going to tell you? The first thing that most people are going to go to is over-the-counter medications, anti-inflammatories, or even as far as opioid medications, depending on the severity of the condition. There's also options for non-surgical interventions, including steroid injections, Hyogan, which is kind of your rooster comb or hyaluronic acid injections, neurotomy, which basically means just burning the nerves. People also utilize bracing, chiropractic care, acupuncture, physical therapy. The list goes on. Or basically the next option is, if those don't work, let's go to surgery. Let's replace things or remove things or scrape things. But there's risk associated with that as well. So basically what we look to do is we look to fall in place right between the other non-surgical options that are being offered, like steroid injections or hyaluronic acid injections or the other things that are Band-Aid fixes, and try to insert ourselves into where before people go to more aggressive treatments like surgery. Ultimately, we would like to be the first consideration for people, to try to prevent further degeneration and further problems from happening as time goes on. So really, we're looking to let the body heal itself. Surgical orthopedics, why this won't be the dominant form of care in the 21st century. If you look at the studies, 95% of meniscus surgeries just remove the needed meniscus spacer rather than repairing it. Research is now showing that removing that meniscus tissue actually speeds up the onset of the arthritis. So you're taking out the cushion. Of course, you're going to speed up the rate at which that joint breaks down. So our job is to try to stop cutting stuff out and inject these biologic agents that can actually help the tissues heal. So with interventional orthopedics, the invasive surgery that requires opening or cameras or incisions or stitches or whatever is going to be replaced by precise image-guided procedures that are needle-based. And on the right here, you can see us the ultrasound machine or the fluoroscopic machine that we use for guidance. And again, the goal is to create less invasive procedures to avoid the need for more invasive surgeries. And when we look at accuracy in stem cell injections, some procedures, some doctors will do procedures blind, which basically means that they're injecting the needle and not really know where they're hitting or if they're actually in the area of the target. You can have low accuracy guidance, which basically means that maybe the physician has a good idea of the anatomy or uses some other form of guidance to help with placing the procedures. But when you're looking at really accuracy and precision, you want to go with somebody that's using a true visualization of the structure and a true visualization of the needle placement. And that's a very low percentage of the doctors across the nation and across these studies. So this is a good example of precision with these injections that we do. This is injecting into the labrum of a shoulder. You can see the very precise needle placement at the top part of the shoulder does allow for injection and contrast flow through that labrum which directly identifies the target of what we're trying to accomplish. And you can also see the very fine contrast line in the joint, showing that there's good placement of cells into the joint and around the cartilage layers that need to be addressed. With this is an injection that I did for a rotator cuff tear. You can see between the red lines is where the rotator cuff injury is actually occurring, and placing that needle directly into the tear in the rotator cuff itself, and placing those cells very directly into the area where compromise is occurring. If you look at post stem cell outcomes from rotator cuff tears, even complete rotator cuff tears, on the left, you can see there's obviously a large rotator cuff tear where the red arrow is. There's contrast fluid that's flowing out through the tear, and that's all that white area around that. On the right side of the image, you can see that that tear is very much closed with good tissue. There's no longer contrast escaping from the joint, and it's near complete healing of the tendon itself. So the results overall, what we're looking for is less pain. We want to help with increasing function. We want to improve your mood, because everybody knows that anybody that's had pain for a long time, it's not the greatest thing in the world and you don't feel good. We want to be off of any pain medication. That includes chronic anti-inflammatories or other opioid medications. And we want to get you back to your preferred and active lifestyle. So again, with the differences, why these differences are important. Medical specialists, this is a big thing, especially in the community in Pennsylvania. The doctor that you want is going to be an expert in musculoskeletal care and more trained in specialty than the vast majority of other doctors. So you're looking for strictly physicians, not PAs, not nurse practitioners, not chiropractors. You want somebody that has specialty training. All of our physicians are fellowship trained in delivering these injections, and we've been doing it for a long time. So you want somebody that really knows what they're doing and how to do it. You want an expert physician with the knowledge, skills, and experience, not just somebody that dabbles, and not somebody that has just spent a weekend getting a course in this and doesn't know how to deliver these interventions effectively. You want the right doctor that can make the right diagnosis and provide the right treatment. And I'll be honest, the right diagnosis is very much the key in the success of these treatments. If you can't figure out where or why you need to do these treatments, then even somebody that can provide these treatments accurately may not be treating everything that needs to be done. So you want somebody that knows what they're doing for specific pathologies that you have, which is very important. Regenexx differences, again, cell source. You're looking at safety, viability, and compliance with the FDA. We want our cells to be, viable. We want the procedure itself to be safe, and we want to meet all the compliance with the FDA regulations. Basically, you get your bone marrow cells, nobody else's. You don't get any other cells from any other third party. Your stem cells are alive and they're properly dosed. We actually measure the viability of the stem cells in the office, in the lab, before we deliver them to you. It means that you get the most researched procedure that has the best safety and viability. You also get the peace of mind that comes with knowing that you're going to get good results and you're going to get good value for the procedure that you undergo. Harvesting, this means acquiring the stem cells. This is important because you want to get the most living viable cells that you possibly can from your body, particularly from the bone marrow. With the way that we process our cells, we are able to get the highest dose of cells possible, harvested with the best technique, utilizing the least pain. Obviously, for people, this is kind of an off-putting thing, thinking about taking cells from the bone marrow and using them. But we do this in a way that keeps people very comfortable, keeps the discomfort at a very, very low level, and people do very, very well with these procedures. We know exactly how to extract the most nucleated cells from your body so that you can receive the maximum dose for the greatest possible success. And knowing how to approach the whole body is also something that we take into account. You don't want to just address the specific issue of my knee hurts. You want to look up and down the chain, what's happening with the hip, what's happening with the ankles, what's happening with the rest of the musculoskeletal system. Are the nerves in good working order? Is there good symmetry in terms of muscle activity and all these other things that go into having a successful treatment? The analogy that I usually use is if you put a new tire on a car and you don't balance it and align it, you're going to end up with the same wear and tear that you did before you put the new tire on, because you're not looking at everything else that can contribute to why that tire is wearing out. So we do take time to look at all of the different factors that may be creating problems for people. So safety, when we're talking about safety, Regenexx has the largest safety paper that's been published worldwide. We've taken a sample of over 2,000 people and looked at, outcomes, long-term outcomes, and any possible adverse events that happen with this. It's deemed to be very safe. Any adverse reactions, the most commonly reported adverse reaction was just pain at the injection site. So, a little bit of discomfort from where the needles are inserted, but other than that, complications are extraordinarily low. So who can you trust? And this is a big slide for people to pay attention to, especially for other types of stem cell treatments that are offered around the community and around the world, really. If you pay attention to these two pictures, the picture on the left is stem cells that have actually been taken from the bone marrow of patients that are between the ages of 50 and 70. And they were cultured on these plates, and you can see all those purple dots reveal stem cell cultures. On the right are plates that samples from a product called Libion Pure, which is a quote unquote amniotic stem cell product, was plated on different petri dishes. And as you can see, these plates are completely blank. There's no stem cell growth whatsoever, meaning that there are no live cells that can culture within these products. So really what you're getting is dead cells that can't be cultured and can't grow, but they're still touting these as stem cell treatments. So the takeaway from this is that any amniotic or placental or umbilical cord or wart and jelly tissue quote unquote stem cell procedure actually contains no live cells. And this has been confirmed by multiple different studies across multiple different academic labs in the nation, including UC Davis, Cornell, Emory, Harvard, a bunch of different places that have looked at this. So another myth is that they say that my stem cells are too old. Not true based on our peer-reviewed data. We're now seeing that older patients using their own stem cells fared no worse or better than younger patients. In fact, a lot of the patients that I have that are even higher in age tend to have more stem cells when we harvest them than even the younger patients. So it is true that you do lose some stem cell numbers as you do age, but in terms of culturing and in terms of acquiring the samples that we need for treatment, there's no, we get a good number of cells from everybody. The analogy that I use sometimes is that if you have a gallon of ice cream to eat, you may only need 2 scoops from that ice cream to be effective. And that's essentially what we're looking at, but if somebody takes another scoop out of the top, you're still going to have 2 scoops that you need to get your share. So, even if there is a little bit less from the whole, we still get as much as we need to do the treatments. And their stem cell products, older stem cell products, your stem cells are going to always be much more effective than other stem cell products like these amniotic or placental based stem cells, because their products contain dead cells. They're not living cells. They're not active. They're not viable. So red flags to look at when you're looking at alternatives, if there's heavy emphasis placed on discounting or financing, or if there's a lot of swing in terms of what they're offering from a financial standpoint to get you to do the procedure, that's something that I highly caution people on. People sometimes say it can feel like a used car sale. If they tout their stem cell treatments as being a magic cure-all, meaning that they offer to treat everything from Alzheimer's to multiple sclerosis to cerebral palsy, we know what we do and we kind of stay in our lane with that. We don't claim to treat everything and anything. If they say that everyone is a candidate, we meet with everybody, like I said, and we decide on candidacy and what we can do. So there's always a good discussion about that. And if they're doing anything like amniotic, placental, or cord blood stem cells, quote unquote, and calling it a stem cell procedure, there's no evidence that shows that there's any live cells in any of those mixtures. If they're doing fat-based stem cell treatments and they're using enzymes to extract the stem cells from the fat, that's outright illegal in the United States, according to the FDA, and it can't be performed legally. Regenexx differences. If we look at visit flow in terms of what you can expect when you come in for different procedures, if we're looking at platelet-rich plasma or platelet-based treatments, we're going to do an initial visit with you. It's going to be about an hour. We'll do a blood draw when you come in for the procedure, and we do the injection on that same day. Usually it's about an hour and a half, maybe 2 hours apart. Following that procedure, you're probably going to go into some physical therapy if needed. We kind of decide that based on the extent of the procedure and what we need to do as a follow-up. And then we usually follow 1, 3, 6, and 12 months after the procedure to kind of monitor the responses and make sure everything's going in the right direction. With stem cell treatments, it's actually a little bit different. The stem cell procedures, there's actually 3 different treatments that happen with that over the course of about a week. At the first appointment, we're going to be doing some treatment with prolotherapy, which is a sugar water-based treatment to kind of prep the joint. The second day is going to be the stem cell extraction, which you can see here in the picture on the right is going to come from the backside of the hip. A couple hours later, we're going to do a re-injection of stem cells and platelets that come from the bone marrow back into the area that's problematic. And then the third appointment is going to be some additional platelets that we'll do from a blood draw. And that helps to add some miracle grow to that stem cell process and keep that area or that process moving forward. For the stem cells, like I said, the visit flow is similar. It's just a longer procedure to get done. The first initial visit, same, is going to be about an hour. We'll do some additional imaging if we need to at the time of the initial evaluation, whether that's in the office or ordering any additional imaging that may be warranted. Day 1, till the soil, that's with the prolotherapy. Day 2, plant the seeds, that's putting in the stem cells. Day 3, fertilize, that's adding that additional PRP, the miracle grow. After that, people usually start into physical therapy about a week after the procedure. There may or may not be some bracing associated with the procedure, depending on what we do. And then again, 1, 3, 6, and 12 months follow-ups to monitor progress. Post-care physical therapy, I think that this is very important after the procedures, but you're going to have about 60% less physical therapy following these procedures than you would after a surgery. So it may only be a few weeks, and usually people improve pretty rapidly. Focus is going to be on improving motion, strength stabilization, and making sure, again, we focus on everything up and down the chain. It's usually in person. Some people do some DIY things at home, but I try to keep people in person doing as much as they can under the guidance of the physical therapist. That's where I've seen the best progress. And so referring providers, including myself, are also available for questions from the physical therapist or patients if needed. So who is this for? It's for people that want to avoid surgery. It's for people that want to keep all of their parts and not have replacements or other metal in their system. For people that don't have a lengthy amount of downtime to dedicate to recovery and physical therapy. People that don't want medications or other drugs that may be necessary after bigger surgeries. People that have had failed surgery before and don't want to go through more, or know somebody that may have had a bad outcome. And maybe there's medical contraindications for surgery, bad hearts, lung issues, other things that may be making you a poor candidate, or even you may be too young for surgery. I know people that are, in their more middle age that don't want to progress with a hip replacement or a knee replacement at an early age because there are complications that come with that too. So, we try to keep everybody off of the operating table as much as possible. So when we're looking at cost differences, prolotherapy, platelets, platelet-based treatments for the spine, and stem cell treatments, there's obviously a large variation in terms of monetary requirements for that. And we talk about that depending on what type of treatment we're going to be doing. Insurance covers everything, including it covers the consultations, follow-ups, diagnostics, bracing, and physical therapy after the procedure. Insurance will not cover the regenerative procedures. So the prolotherapy, the platelets, platelets for the spine, and stem cells will not be covered by the insurance. But when you look at copays and deductibles for regular orthopedic surgeries, you may actually be paying more undergoing surgery and having to go through extensive physical therapy. Also, time that's lost from jobs or downtime or whatever else may happen. Or God forbid, you may need a revision surgery or something more than that. Those costs can sometimes be extremely more than the procedures that we're offering. And again, we offer customized treatment plans with wide price ranges. So it's, everybody's going to have a plan that's basically just for them. So we're looking at also some self-funded employers to try to get some insurance coverage with these procedures through certain employers. Right now, we have over 6 million lives that are covered under these insurance programs, and we're looking to do more. But there are some big companies, that are coming on board with this, and we're hoping that we can continue to spread this so there is more coverage offered, and we'll see how this progresses in the future. With the procedures, there are some supplementations that we promote, including the advanced stem cell formula, which actually has a variety of different good vitamins that help with cartilage and tissue recovery, along with other anti-inflammatory agents and other things that contribute to cartilage and bone and tendon healing. We have fish oil that helps with, just recovery as well, but also with joint fluid lubrication, decreasing inflammation systemically, and turmeric curcumin complex, which also helps with generalized inflammatory reductions and health in the brain, the gut, all sorts of different benefits to help with decreasing inflammation and improving life. So, like I said, our main office here in the center is located in our Fox Chapel location. This is where most of the regenerative procedures happen. However, like I said, we have offices all around the Pittsburgh area where we're currently seeing patients in both initial evaluations and follow-ups. And so we have all sorts of different locations that you can call and be seen in. So the next step would be to contact our scheduling liaison, Sarah, to schedule an in-house or a phone consult. The number's there, and you can get a hold of us at any time, and we'll be happy to schedule you for an eval. So I'm going to leave it open for questions here. I am going to look at our question list here. So first question is here, and I'll even see if I can bring up my video for you guys so you can see who you're talking to. There we go. So first question here, does the age of the patient affect the outcome success? Is an 83-year-old a good candidate if cells also age in an older process? So I answered that question sort of through the course of the presentation here, but yes, even 83-year-old candidates are good candidates. I've treated people even up to the age of 98. And again, having excellent stem cell counts. So, it's not something that, like I said, as you age, you become less and less affected by these treatments. The healing process is a little bit slower for patients that are older, but people are still getting good outcomes even into later years. I have somebody here that asked, physical therapist looking for opportunities for my patients for care. What's the relative cost? My patients tend to be of lower socioeconomic status, and I would recommend something that they would have sticker shock for. So I understand that, again, there's, some issues with the costs for some of these procedures. When we're talking about different treatment plans, some of the treatment plans that we offer are not as cost, inhibitive as some of the other plans. But again, we offer the treatments for patients according to what we think is going to give them the best outcome. So, I tell people what I think is going to give them the best amount of relief. There are options that we put in place to try to help people with that. So I think no matter what the person's status is, I think they should at least come in, have the evaluation, hear what we have to say, get the diagnosis that matters for them, and then we can decide on what type of treatment would be needed, no matter what that might be. Next question, is there a limit to how many stem cells can be injected if there is a large area of arthritis? There's not necessarily a limit to how many stem cells can be injected. I don't know kind of how to answer this question. When we do our stem cell treatments, we have an average stem cell count of about 600 million to 1.5 billion. Some people are a little lower, some people are a little bit higher. So there's a large, basically if you're getting, in that range, you're getting a good stem cell treatment. And different joints, different volumes can be utilized for different joints. So we always get the amount of stem cells that are going to be necessary for appropriate treatment of what that patient's injury or arthritis may be. For knee pain, how would results differ for stem cells versus platelet-rich plasma on the knee? There's a lot of information on this. It depends on really how extensive the arthritis is, and there are a multitude of other factors that go into that. So that's kind of a difficult question to address, not knowing what the patient's actual problem is. But, stem cells are usually always superior in terms of their healing capability. I usually tell people situations where there's more moderate or mild to moderate arthritis, that typically will give you better results that can give you good results with platelets in some situations. More extensive arthritis, end stage arthritis, usually that's where we're looking at stem cells to be the more common treatment option. It doesn't look like I have any more questions. I'll keep it open if anybody else wants to chime in or if anybody has any additional questions. However, I really appreciate you guys being present for the talk. I hope you guys were able to learn something. Oh, one more question. Can you inject multiple areas at the same time? That's a really good question. So what I'll say is with certain treatments, like with PRP, we can do multiple areas at the same time, depending on what we're dealing with and what's happening. With stem cells, that becomes a little bit difficult because when we're using stem cells to focus on a joint, we know how many we get the cells that we need, but we never know how much of a volume we're going to have with those cells. So it's always variable for patients, and I try to focus on the one joint that is in the most need to try to address the most bothersome joint at that time, because I don't want to steal stem cells away from that area to treat another area, and we may be getting two suboptimal treatments at the same time. So sometimes what I'll do is, I'll treat the main joint with the stem cells, and I'll use some platelets in addition to that to maybe treat some other areas that may not be as problematic. But the answer is yes, we can. It just depends on what we have and what we're offering and everything like that. And you are very welcome. Thank you for saying that. I appreciate it. I hope it is good info for you guys. I hope it answers a lot of the questions that you have. So if there's any other questions, if there's any other concerns, if you want to make an appointment, please give us a call. I appreciate you guys listening. Like I said, if you think of any burning questions, write into the Facebook page, comment. That's always helpful for us. If you want to just answer, if we want just a quick question, email us. And we're happy to get back to you. We're happy to contact you. We're happy to send you whatever information you need. Thanks so much again for hanging out for the webinar. And we hope to talk to you guys soon and hopefully see some of you soon. Thanks again.